Zoe Sudami. I'm a clinical pharmacist. I specialize in ambulatory care. And on today's episode of This Is Your Health, we'll be talking about diabetes education. So starting off with diabetes, what is diabetes? Diabetes is a chronic health condition, which means you have it for a long time, and is characterized by the inefficacy of insulin. So insulin is a hormone that our bodies produce to help bring glucose out of your bloodstream and into your cells for effective use. We all need glucose. Glucose is a fancy word for sugar, and we need it for our organs to function effectively. So diabetes is diagnosed by a series of tests, either an A1C or just chronically high blood sugars. Before you even go to the doctors, you might be feeling symptoms of hyperglycemia or high sugar. You might feel very tired, very weak, very thirsty, might be peeing excessively. All of these things can point to high sugars. So there's different classifications of diabetes. Type 1 diabetes is an autoimmune disease. We usually see it in very young kids or in young adults, and this is when your body attacks its own cells and it's not able to produce insulin on its own. So these people are insulin dependent. Then we have type 2 diabetes. This is a lot more common, and it's when your body is able to produce its own insulin, but that insulin just isn't effective any longer. So that insulin isn't doing its job of taking that glucose out of the bloodstream and into the cells. Then we have gestational diabetes. Gestational diabetes is diabetes that is developed during pregnancy. A lot of times people, even after they have their babies, still have that diabetes from being pregnant. Hemoglobin A1C is a term that your doctors will talk about when you go into clinic. We'll either do it on a lab test or we'll do it when you're sitting face-to-face in clinic. And it's a 3-month average of all your sugars. And this is how we determine if you have uncontrolled diabetes, well-controlled diabetes, or even if your diabetes is in remission. And this means it's well-controlled without any medicine. So for normal A1C, your A1C would be less than 5.7. For our A1Cs, that's considered to be pre-diabetic range. It'll be between 5.7 and 6.5. A1Cs greater than 6.5 would be indicative of diabetes. So there are a lot of different risk factors to diabetes. We know that it can run in families. So if your family members have diabetes, you are more risk for developing it yourself. We also see that it is more prevalent in our Black communities, in our Hispanic communities, and our Native American communities. We see that people that are obese or inactive are also at higher risk for developing diabetes. If you have high blood pressure or high cholesterol, or even have endocrine disorders like PCOS, that can also put you at higher risk for developing diabetes. So there are different glucose levels, and we'll talk about this more when we talk about checking your sugars at home. But it's important to kind of know what sugars are normal and what sugars are high. When you're waking up in the morning, your sugars should be between 80 and 130 without any food in your system. Now, 2 hours after you eat, we want those sugars to be consistently less than 180. And again, your A1C, that's the number we determine if your diabetes is uncontrolled or well-controlled. Well-controlled diabetes is considered to be an A1C less than 7%. So if we look at diabetes, and if it's a pie, I would say 2/3 of that pie is going to be focused on your diet and your exercise. The third of your pie is going to be focused on that medication. So it's really important, especially if you have type 2 diabetes, that you're staying on top of your diet, eating lots of fruits and vegetables, and also exercising at least 120 minutes per week. So going into our diet, with diabetes, it's really important that you get in your diet, your fruits and your vegetables. Every time you sit down and you look at your plate, 50% of your plate should be filled with green things, whether that's broccoli, kale, spinach, whatever it is that you like that is green, fill up your plate with it. Your other fourth should be starch, like rice and potatoes, things like that, and then a fourth of your plate should be protein, fish, chicken, beans, tofu. Your doctors might prescribe you medications for your diabetes. Metformin is very common, and there's other ones out there like Ozempic or Trulicity that are also rising in popularity too. It's important when your doctors prescribe you a medicine, you ask about how you take it, what to expect from it, different side effects. Never be shy to ask your doctors questions about the medications that they're prescribing you. Next comes insulin, and I know insulin can be very scary for a lot of diabetics, but one thing that's important to remember is that all of our bodies produce insulin. So we need that insulin, again, to effectively use the glucose in our body. So it's not something to be afraid of. There are lots of different kinds of insulin, so definitely ask your doctors when to use that insulin, in relation to your food, in relation to your sleep, what to do if your sugars are running too high or too low. All of these things are very important when you are injecting insulin. Now we're going to blood glucose and how to monitor your blood glucose. So you're not going to be at your doctor's office every single day, so it's important that you know how to check your blood sugars at home. So we have traditional glucometers where you put your blood on a test strips and it's able to give you back a number that's indicative of how much sugar is in your blood at that moment. We also have continuous glucose monitors, and these are newer inventions, and you can talk to your doctor about prescribing them as well. And you can wear it on your arm or on your belly for 10 to 14 days, and they consistently read your glucose throughout the day while you're sleeping all of the time, which is really nice because it takes away the burden of having to poke yourself and test your blood. Again, it's really important that you know what your sugars are throughout the day and that you know what they mean and how they can relate to your overall diabetes control. So what are the complications of diabetes? Why do we care so much about it? Again, diabetes is a chronic disease. You have it for a long time. And the problem with diabetes is that if it's uncontrolled for years on end, we're looking at things like nerve damage, foot problems, heart disease, going blind, ending up on dialysis. All of these things are very common for people that do not control their diabetes. So if you know anybody with diabetes or you yourself have diabetes, make sure that you are doing the best that you can to follow your doctor's instructions with your diet and your exercise and being able to control that diabetes. That concludes this episode of This Is Your Health. If you have any questions, please feel free to leave them in the comment box below or send an email. Thank you so much.